All right, y'all. Sunday. Well, I didn't upload anything yet from Thursday and Friday, but anyway, Thursday was an easy day. I had pre-transplant class and support group, so it was pretty good. We got to hear some stories about some lung transplant survivors and how they're doing right now. Kind of help put everything at ease a little bit, so not as nervous as what I was before about 2 months ago, so that's good. I was a nervous wreck. I'm still scared, but I mean, that just comes with it, right? So, anywho, the support group was pretty good, very informative. They're just great people, man, just to hear their stories. And one of them, actually, this lady, she had to have 2 operations. She had to go through the transplant twice. And now she's doing great. So, Friday was a little bit more intense for me. Had the right heart catheter done. They went into my groin. And I didn't get no medication to block the pain or anything like that, like they said they were going to do. But yeah, that didn't happen. Maybe I should have just requested it, because they told me I could, and then another doctor said, "Oh, when the main doctor comes in, he's going to ask you if you want it. And you just tell him yes." I was like, okay. That didn't happen. I was waiting for them. Then all of a sudden, it was, okay, here comes some lidocaine. And give me a shot right in my groin. Hurt, yeah. And then, I guess they did the catheter right after. Still hurt like hell. And then he starts putting pressure on it, starts hitting it, asking me if it hurts. Yes, it hurt. I wanted to cuss him out, but I'm not going to do that with somebody holding a needle in my groin area. I mean, it just wouldn't be good, right? So, yeah, so I just had to sit there and take it. And so, that wasn't good. But after so many seconds, it felt like minutes, I just looked up at the screen, and I could tell I was doing okay, though, because my heart rate wasn't going up. My blood pressure was still good. Then I just saw the little wire going through the arteries and seen the picture of my heart pumping and all that good stuff. So then they injected the first dye, and that made me feel like I was having a heart attack. It felt like a nasty cramp in the middle of my chest. They didn't even tell me to get ready for it. They just did it, and I just felt it, and it was very, very uncomfortable. I mean, not unbearable, it was just very uncomfortable. Then after they did that, they said, okay, we're going to shoot the last dye, and it's going to burn your leg. I said, okay. That's all they said, it was going to burn the leg. It was going to get real hot. Nope. Nope. That's not all that happened. It wasn't just really hot. It burned. Burned really good. And then it felt like my whole left leg just had a cramp, but like 100 times worse. It was painful as hell. So yeah, they never gave me no medicine. Nothing blocked pain. Just had to take it. And that was that. So overall, though, it really wasn't that bad. Now that I think about it, it was bad at that moment, but once it was done, it was like, yeah, no big deal. Then, of course, they put some kind of, some kind of plug in the crotch inside that main artery. It's going to be there in there in my groin area for 90 days, 3 months before it dissolves. So, I guess, let me see, tomorrow I have a social work evaluation. I have to see a psychiatrist, a pharmacist, a nutritionist, a financial coordinator, and it just says research, so I have no idea what that's going to consist of. So yeah. Other than that, this week went by pretty fast. That was the most painful procedure yet so far. So, I guess on to the next. I mean, there's really not much to it right now. Still got a lot of questions. So hopefully, I don't know when I'll find out if I'm accepted onto the list or not. But I'll be sure to keep you guys updated. So, I mean, if you guys have any questions, like I said before, man, shoot me a comment. If I can't get the answer to you right now, I will find you an answer, and I'll reply back to you, all right? So, anything, drop me a comment. Appreciate it. Bye.